Dr. John Q. Cook from Chicago. I'm here with two esteemed colleagues, Dr. Renee Burke, who practices in Barrington, right in the Chicago metropolitan area, and Dr. Anu Bajaj from Oklahoma City. We have an interesting topic for today. It seems like more and more men are seeking plastic surgery. The stereotype, of course, was always that this was predominantly a female field, and it's interesting to get perspectives from male and female plastic surgeons about what are you seeing with your patients. Anu, what seems to be coming into your office in terms of what patients want?
Well, I think when I see the men, I think they're coming in with similar concerns, or they want similar surgeries. I see a lot of men who've lost weight and they want abdominoplasties. I also see a significant number of men who want male breast reduction for gynecomastia. A lot of men also want their eyes done. Sometimes they want some chin lipo. And so I think they're coming in for similar issues as women do, but we have to treat them differently because the goals are different.
Absolutely, and I think it really does depend on the age too. When you look at the younger patients, it is predominantly more liposuction, usually things that have to do with more body contouring. But as they age, I have more and more male patients that are very concerned about like their neck, but they don't want their face to look done. So, they want to have some aging removed, but not make it look so obvious. And their techniques that we use are different, And
I think the Zoom phenomena has really added to this.
Absolutely.
Both male and female patients. Everybody's aware of their neckline now because they keep seeing these pictures, right?
Their neck.
And that's really driven
their
it.
eyes.
Yeah.
Think about it.
Right.
For a lot of women, we talk about not just an upper eye lift, but a brow lift. You have to be very careful. A man shouldn't have a high arched brow. It should be straighter. So these are the things we're always taking into consideration. When we're operating on the patients.
So how do we communicate to our patients these different approaches? Do you have a simple way of doing it?
When you talk to a male patient, you ask him what his goals are and what he wants to achieve, and then you have to talk to them and develop a rapport about what's going to be masculine looking. You don't want to feminize your patient because that would defeat the purpose.
Right. I had a male patient just frankly ask me, I was a little concerned coming to a woman that you would give me a more feminine, sculpted outcome. And so it's really important that you have that open and frank dialogue with your patients beforehand.
I couldn't agree. I think it's more definition and looking vital for a male patient too.
Right.
Now let's face it, it's a competitive workforce. There's a lot of turmoil, job shifting, especially if you reach a certain age, it really can make a big difference for people. So that's a big motivation, both for men and women, I see in my practice.
At the end of the day, everybody just wants to feel the best version of themselves. So, we help everyone, right?
Absolutely. If you're more interested in any more information about this fascinating topic, just visit theplasticsurgerychannel.com.